All right, it would behoove us helping pregnant women stay comfortable during their pregnancy, help them avoid difficult labor or unwanted C-sections. I had 39 and a half hours of labor.
You know what?
So I can relate to this story.
Yes, you can. And the men can relate just because they have to be there with the wives. But sounds like a tall order. Our guest today, Dr. Elliot Berlin, says it can be done. Okay, the obvious question, Dr. Berlin, thank you for joining us, first of all, is how?
Well, the first thing starts with pain. Pain during pregnancy is not normal. It's very common, and so a lot of women think it's normal. I'm pregnant and I'm uncomfortable and there's nothing I can do about it. But especially if the pain is around the pelvis, the low back, the hips, the buttock, the pubic bone, that's an indication that your pelvis isn't functioning quite right. So the muscles are too tight and spasmy, or the bones are restricted, and that can create a problem for you on Labor Day.
Hey, Dr. Berlin, now you have the Berlin Wellness Center, and of course you have acupuncture there and chiropractic help for women who are pregnant, which I wouldn't think of during pregnancy.
Yeah. Chiropractic, acupuncture, and massage, yoga, anything that you can do to normalize the pelvic structures, to loosen the muscles and bones so that they don't restrict the natural passage of the baby during labor and delivery. They also make you exceptionally comfortable during pregnancy. Our patients generally enjoy a very comfortable pregnancy and maximize their chances for safe, traditional labor and delivery.
And again, it's all about managing your pain. How many pregnant women out there are in pain?
Oh, tons. I mean,
yeah.
Well, and how do women, and this is a big thing with a lot of women, avoid unnecessary C-sections?
C-sections, a lot of the reason for the rise in C-section are because babies can't pass through. You have breech babies that can't position well. You have babies that get stuck or prevent labor from initiating on time. If we do things like open up the pelvic bones, relax the pelvic musculature, do a little training before the big day, you maximize your chances for that safe, uncomplicated traditional birth.
Okay, that's interesting. I always thought that the increase in C-sections was because a lot of mothers are choosing to schedule their births.
That's actually just a small number. Small number of elective C-sections. A lot of them are being indicated by the baby's inability to drop.
Dr. Berlin, a lot of useful information in a short period of time. We really appreciate you squeezing it all in, and you're coming in as well.
My pleasure.
Dr. Elliot Berlin of the Berlin Wellness Group. All right, we are in perfect condition. No breech birds up on Sky Fox. You know what?
Hey,
Just all